Hi, my name is Lee and I was diagnosed with Parkinson's disease in 2005. It can severely affect my ability to move, often resulting in frozen gait, fatigue and body tremors. Already I've seen great personal progress through my therapies, and I do believe there is hope in reducing the severity of symptoms with the goal of becoming asymptomatic. Today I'm going to share one of my beneficial therapies I use. Dry needling helps with muscle release and pain reduction. I combine this with medication, a balanced diet, exercise and other physical therapies. So welcome to my needling appointment.
Cool. Okay. Awesome. So dry needling is similar to acupuncture in that we use small single-use sterile needles. It's more Western based than your traditional Chinese acupuncture. So instead of looking at some of the more traditionally used methods of meridians and energy channels and some other really good evidence-based stuff, we're purely looking at the physiological responses of the body to a needle. So how when we introduce a needle into a body, we get local vasodilation, so blood vessels opening up. We get a localized immune response for the body recognizing a foreign particle or body in there, as well as some theories behind causing local release of pain mediating chemicals and changing the sensation of pain in an area. As well as when we needle into an area and do some active dry needling where we actually move the needle around, we can get small little muscle twitches, which is those nerve fibers firing off, causing a muscle contraction around the needle, which makes the muscle contract temporarily around the needle and then relax out afterwards. So we do tend to find that doing a needling session on a muscle is similar to doing quite an intense bit of heavy deep tissue massage on the area. So you can often get a little bit of post-needling soreness after the needling, sort of as if you've had a really heavy massage or done a bit of a workout on that muscle. So the reason we have used it with Lee was looking at trying to keep any tight muscles loosened up and functioning better so that he can team that with his exercise program. The key point that we've discussed with Lee with his program is always very much any hands-on work has to be paired with what he's doing at home. So his combination of stretching, swimming, meditation is all going to combine to give better results for any program, because hands-on treatment is very limited if it's not paired with active rehab work, especially for Lee with Parkinson's, on balance, on proprioception, and on continuing to work on strengthening his body and maintaining that strength and function. So for Lee, we're mainly working through his lower back, his hamstrings and his glutes, where he had some injuries last year and the year before in those areas, and they were identified as tight areas that were a problem when we did our assessment, as well as his lower back, based on his years of his previous occupation, has left him with a limitation of his lower back that limits his ability to fully participate in functional activities, as well as does cause a reasonable level of pain to Lee as well. So we're needling into the erector muscles either side of the level that gives Lee the problem, in around his L1, L2. In this needling technique, I'm using a little bit of a combination of needling. We wouldn't normally needle this many people, but Lee has developed the way that he likes to be treated. So we would normally be more area specific and pick an area to needle. However, Lee likes to have them all treated. And it's not something that we would normally recommend purely because of the level of intensity to treatment this does create. It can make it a little bit tender afterwards. However, Lee's worked himself up and gotten used to it and now enjoys the sensation afterwards. So we've gone through his upper traps, his rhomboids, in through the back of his shoulder and his infraspinatus. We can use smaller needles, especially when we're going through these areas. We're using a slightly longer needle just to make it more visible for the camera. Key point is obviously we just don't puncture them all the way in. Key areas that we have to be very careful of are up in through the chest wall area and in through the top of the traps here, where the lung does sit quite close to the surface. So it's very important to for the technique to be done appropriately so that it doesn't puncture the lung or any tissue that it could damage. So it's always important to make sure if you're having any needling technique done, that the person has performed the appropriate training courses to ensure that you're safe. Now you wouldn't have seen it on the camera because I was off camera when I did it, but we always clean our hands, usually with soap and water or aqueum, or a hand sanitizer solution before touching any of the needles and before performing any of the needling. And that's just because we're still introducing the needle into the body, so we want to make sure that it's nice and clean and sterile. So now we're going up into the suboccipital area. And this area can be associated with headaches and neck pain. And also Lee has found that needling this area helps with his neck tremors. And our last one on the side is our wrist. So we're going to leave those in for a few minutes. We'll come back, stimulate each of them. And when I say stimulate, I mean gently move them in and out in through the area to stimulate the muscle that they're in. We'll leave it for a little bit longer and then we'll reapply them, remove them and apply the ones onto the front of Lee's body.
Yes, it's like a tingling sensation. It's quite invigorating. And I find it quite a stimulating process all round.
Mm. One tiny little bleeder. Most of the time they don't bleed or anything. Occasionally you get one tiny little one. It's always the one in the hairline if it's going to bleed. Now we're just doing the hip flexors, lateral quads and the tibialis anterior. And same thing, we'll leave those for a minute, stimulate them and then we'll remove them again. It's not specifically used for neurological muscle stiffness, but what we're looking at is there's certain levels of Lee stiffness that we can work with in where the muscles are tight or they're just switched on too much, so we can help with that and combine that with stretching. But things like the actual neurological stiffness related to Parkinson's, some of that is going to be medically treated as well with his medication. So it's combining the two there. As I said, one of the key things is I think he's combining a lot of treatment. So he's working on his meditation, he's doing his mindfulness, his stretching, his strengthening stuff, doing his swimming, walking in the water, and that's all really good for what you're trying to do. And trying to eat healthy.